Welcome to Jackson Developmental Center and Jackson Children's Services COVID-19 Reopening Safety Plan, Training Module 2, In-Person Early Intervention Services. The return to in-person early intervention services. Now that New York City has reached and passed Phase 3 of its moving forward plans, the New York City Health Department Early Intervention Program has issued guidelines for the reopening of early intervention in-person services. The following services may now be provided in person: home-based or community-based early intervention services, multidisciplinary evaluations, supplemental evaluations, and individual facility-based services. For Jackson Children's Services, as of July 20th, 2020, any EI provider who is trained and certified in the Reopening Plan Module 1, Safety First and Always, and Module 2, In-Person Early Intervention Services, will be eligible to provide in-person services on behalf of Jackson. Please pay attention that the ability to provide in-person services will remain subject to change based upon local health metrics and updated guidance from New York City, New York State, and the CDC. While in-person services are now allowed, the availability of teletherapy services will continue, and in fact, teletherapy services remain the preferred service delivery model for this time. Therefore, all Jackson providers must discuss with families that the teletherapy is still available and must share with families that teletherapy helps slow the spread of COVID-19, provides greater scheduling flexibility for parents, is as effective as in-person therapy, in some instances, increases positive child outcomes, and increases parent engagement and empowerment. Again, in-person services are allowed, but early intervention wants parents to know that teletherapy services are still available and are still the preferred method of service delivery at this time. In order for a child to be eligible to receive in-person services, the parent or guardian must sign a consent to resume or initiate in-person services. This document must be obtained, signed, and uploaded onto NICE before the first day of in-person service delivery. Also, you must have been informed in writing by a JCS program staff member, not just the service coordinator, by either myself, Rita, or Sabrina, that you are able to provide in-person services for a particular child for a particular service. The consents for in-person services are per service authorization and not per child or per family. So every service that you're providing, if you want to provide it in person, there must be a consent for that service on that service authorization, signed and uploaded into NICE for the in-person services. If you do not get program clearance before providing in-person services, this may result in non-payment for your services. On this slide, there is a copy of what the consent form looks like for in-person services. All of the Jackson service coordinators have been discussing with families these consent forms and getting them signed where parents are desirous of in-person services. So Jackson service coordinators are aware and are working with the families. But if you are interested in doing a service in person, you must get written clearance from a Jackson program staff member, myself, Rita, or Sabrina. In addition to the consent for in-person services, all families receiving in-person services must also sign a consent for telehealth services for the same service that they want to be delivered in person. This telehealth consent will allow for flexibility If services have to return to the home, either due to a family member illness or a provider illness or a change in local health metrics, having both consents signed and uploaded onto NICE for the service will allow for the flexibility to provide both in-person and telehealth without any interruption in service. The procedures for in-person services are as follows. Everyone who will be part of the session or the evaluation and who is over 2 years old will wear a face covering during the session or the evaluation, except for the child who is receiving the service. That child will not be required to wear a face covering during the session or the evaluation. Everyone in the home or the location where the EI service is being delivered, but not directly involved in the session or the evaluation, will remain at all times at least 6 feet away from where the session or the evaluation is taking place. Everyone who will be participating in the session will wash their hands with soap and water or use an alcohol-based hand sanitizer immediately before the session or the evaluation begins and immediately after the session or the evaluation ends. Hand sanitizers must be at least 60% alcohol in order to be effective against COVID-19. When children are using hand sanitizers, they must be supervised, and hand sanitizers must be kept out of the reach of children because they are poisonous and dangerous. You must have access to a sink, soap, and paper towels in the location in which you are providing in-person services. If your hands become visibly soiled before, during, or after a session or evaluation, you must be able to wash your hands with soap and water and dry them with paper towel, as using hand sanitizer on visibly soiled hands will not remove the contaminants. Before entering the home for an in-person session or evaluation, you must perform a family health screening. Jackson's Family Health Screening Form follows the Department of Health sample format and requests the following. Does the child, anyone residing in the home, or anyone present for the evaluation or therapy session have COVID-19 symptoms within the last 14 days? Has the child, anyone residing in the home, or anyone present for the evaluation or therapy session tested positive for COVID-19 in the last 14 days? Or has the child, anyone residing in the home, or anyone present for the evaluation or therapy session been told by a doctor or the New York City Test and Trace team to remain home due to COVID-19? An ongoing service provider or evaluator may enter a home only after the COVID-19 health screening has been completed remotely and all of the responses to the COVID questions have been negative. If a family answers yes to any of the COVID questions on the health screening, the provider may not go into the home and must inform Jackson immediately of the responses. The COVID-19 health screening must be done each and every time an evaluator or therapy provider wants to do an in-person session and before that session. The COVID-19 health screening form must be documented on the form that is attached and presented on this slide. This form has been emailed to all providers, and this form is only valid if fully completed and signed by the provider and by the parent and dated, so that we are certain that health screenings are taking place before providers are going into homes. If an in-person session must be canceled and replaced with a teletherapy session, the teletherapy session is instead of and not in addition to the in-person session. So replacement sessions performed by teletherapy for in-person services are not added to, they replace the missed in-person session. Please remember that you are not allowed to bring anything into a home for an in-person session or evaluation. You may not bring toys, you may not bring materials, you may not bring assessment items, nothing. A therapist or an evaluator can bring nothing into the home for an in-person session. The only thing you may bring into the home is paper. In these unprecedented times, Jackson promises to do their part to create safe workspaces and to provide information and training to all of its staff and its families to make sure that families and providers can stay safe while giving and receiving the services they so dearly need. If you have any questions or concerns about this module or about anything else that has to do with COVID-19, we are here for you. I've included my personal information and my work email on this slide. Please feel free to reach out to me with any of your questions. I promise to try to continue to be up to date on all of the federal, state, and local regulations for COVID safety and COVID services and COVID protection. And I promise to share that information with you as quickly, efficiently, and accurately as I possibly can. So now that I have made promises to you on behalf of Jackson and personally, you too have promises to make and to keep, and not just for the times that you are working for Jackson, but for all times. You must promise to practice social distancing, to frequently wash hands or use alcohol-based hand sanitizers, to wear appropriate face coverings that cover your mouth and nose, to avoid touching your eyes, nose, and mouth at all costs, to stay home when you are sick, to clean and disinfect frequently touched objects and surfaces at work and at home, and to think before touching. Ask yourself, do I need to touch this? And if the answer is no, keep your hands to yourself. To stop the spread of COVID-19, it all begins and ends with you. Thank you for participating in Jackson Developmental Center and Jackson Children's Services COVID-19 Reopening Safety Plan, Module 2, In-Person Early Intervention Services.